Ladies and gentlemen, please stand and join as Megan Lawrence, accompanied by her husband Lucas Hanneman, perform our national anthem.
Oh, Canada, our home, our native land, true patriot love in all of us command, qu'à ton bras s'est porté l'épée, il s'est porté la croix. Ton histoire est une épopée des plus brillants exploits. God keep our land glorious and free. Oh, Canada, we stand on guard for thee. Oh, Canada, we stand on guard for thee.
In the spirit of reconciliation, those gathered with us here tonight recognize that our work here today takes place on the unceded traditional and current territories of the Algonquin and Anishinaabe nations. The Canadian Council of the Blind honors all First Nations, Inuit, and Métis people. We acknowledge their valuable past and present contributions to this land, and that their culture and presence have nurtured and continue to nurture. We are committed to renewed nation-to-nation relationships with Indigenous peoples across the whole of Canada, Turtle Island, based on recognition of rights, respect, cooperation, and partnership. Thank you. Megwich. I would now like to introduce Mr. Jim Tokus to give the welcoming remarks.
Thank you, Michael. Ladies and gentlemen, welcome to the Canadian Council of the Blind's annual May 2024, well, annual, Vision Loss Month celebrations. We are so happy you could join us as well to celebrate our 80th birthday as an organization. And so on behalf of the board of directors, our wonderful volunteers and our wonderful office staff, and to the many the guests who've all helped us with making blindness so we're changing what it means to be blind. And it's because of everyone here that we're able to do it. Thank you.
I look out across the room and wow, there's so many familiar faces, new ones also. It's good to see everyone here tonight. Many have traveled great distances to be here, and we thank you. We are truly humbled in your presence in support of not only the vision loss community, but the vision health community who are represented here tonight. I would ask that each of you stand as I call your name. Jim Tokus, National President of the Canadian Council of the Blind, as well as Louise Gillis, immediate past President, and Board Member Leslie Yee. And special guests represented here tonight, Angela Bonfani, Chief Operating Officer of the CNIB. Angela. Francis Couillard, CEO of the Canadian Association of Optometrists. Is he being shy? Oh, I'm sorry, I shouldn't have stuck you in the corner. Jennifer Yuzovic, President and CEO of Vision Loss Rehabilitation Canada. Jennifer Jones, President and CEO of Fighting Blindness Canada. And since I forgot her last year and I don't want any hurt feelings, Larissa Monez, the Chief Research Person and a really important person there. Shania Nenzi, President and Bethany Carey. Shania is the, wait, I did this wrong. Shania Nenzi is the President, and Bethany Carey is the acting CEO, both of the Ontario Association of Optometrists, and we welcome them here for the first time. And Dino Zupa, Chief Information Officer at Accessibility Standards Canada. Didn't make it? Okay. Who'd I miss? I always miss somebody. There she goes. She's right. Actually, it's right here. I had you right there, Deborah. Deborah Gold, President and CEO of Balance for Blind Adults. Nobody else, eh? Now it's time for our annual presentation of the 2024 White Cane Awards. The CCB is pleased to present the 2024 Person of the Year Award to Heather Hannett, National Board Member for the CCB Alderver Division and member of the CCB Cavalry Club. Hannett has been a proud member and supporter of the CCB since the early 2000s and currently serves as the chair of the membership committee, where she thrives on bringing in new members to enjoy the activities at the CCB Cavalry Club, from cribbage to bowling to curling, yoga, learning, braille, and more. See, nobody in Alberta knows how to play euchre. Anyways, Heather couldn't be with us here tonight, but we have a video for you.
Okay, first of all, it was a great surprise to be CCB Person of the Year, especially since it's the 80th anniversary. I enjoy working with people at the Calgary level, the division level, and the national level, and passing things down what we talk about at the national level that helps all people in Alberta and Canada itself. I've been a member of CCB since I was in college, and it helped me in the way that I became more confident going to college and meeting other people with visual impaired. And then I tried working with others and passing on to my daughters who are visually impaired so that they're more confident. They're both working as visually impaired adults. And it's nice seeing people grow. And I still believe that and we can do everything anyone else can do. We just have to do things differently. And this coming year, in 2025, it'll be Calgary Club's 90th anniversary. So we've been around since time began, it seems. And, you know, sometimes it feels like you're trying to keep things going and going, but it's all worthwhile. I've been on the division board for since time began, and people have gone by, and I'm still there plugging away. But we have a good group now. We have our office of our own, and Calgary Club is now in charge with the funds that come in for Alberta. And it's people helping people. And like a little guy said to me at the daycare in CNIB, he said, Heather, sharing is caring. And coming from a 4-year-old, it really gives me great pleasure to know that, we have gone to the daycare and talked about visually impaired people because they see us roaming around all the time. So that's the pleasure I take in, from doing advocacy to membership, learning from others what can help other people across Canada. And I am really shocked to be Person of the Year, but it's wow, I'm still in shock, and I wish I was there today, but there's always things I have to do in Alberta. And I just want to thank everyone for, listening to me right now. I'm not a speaker. So if you can cut and paste, that's good. And thank you so much, Mohammed, for, giving me this chance to say thank you.
The CCB is honored to present the 2024 President's Award to Dorothy McNaughton, a dedicated CCB chapter leader whose unwavering commitment has significantly impacted the lives of individuals who are visually impaired in the Northern Ontario, working with the CCB in Sault Ste. Marie, White Cane Chapter, and Get Together with Technology program. McNaughton has been instrumental in helping Northern Ontario and rural residents who are living with vision loss to come together, whether for community support or to learn accessible technology. Ladies and gentlemen, Dorothy McNaughton. Well, why don't you come stand up in front here? You're on. Thank you. The microphone's right in front of you. You're in a podium, so it's all set for you.
Thank you. Thank you very much. I must say, when Jim phoned me, I was shocked. I've just been plugging away in Northern Ontario and Sault Ste. Marie and helping groups get going in Thunder Bay and North Bay when they contacted me for help. Really determined to see peer support in the North because we're somewhat isolated. And what I find with our chapter, which is 25 years old in June of this year, and that's when I first became involved with the CCB, I find people are so desperate and hungry for contact with other people with vision loss. That's one thing our group does. We socialize, we become friends, we become very close. Somebody can call another member of our group and just to talk or to say, I had a rough day, and, just so someone is there to listen who understands what they're going through. So that's why I got involved in the very beginning. And I'm so pleased right now. Our group is growing. We've gone from 12, 15 people maybe to over 30 right now. 2 new people in the last 2 weeks. And some of the newer people in our group say to me, I didn't know where to turn. I don't know what I would have done without your group. It just makes me feel so good that we are helping others, that we are giving them encouragement. We encourage them to be as independent as possible. We advocate for things like Parabus services. Sault Ste. Marie only used to provide services to people with mobility issues. Now, after 2 years of lobbying, They provide pair bus services for people with vision loss. And the other thing we do is, we support and encourage one another in so many different ways. The technology, I am not a techie, I must tell you that. In fact, at 7 o'clock tonight, our Northern Ontario and Rural Get-Together with Technology group meets. We meet the third Tuesday of every month, and we have speakers. We have speakers from AMI. In June, we have a speaker from AMI. We get information out there for people who need it, and there are so many things that people don't know about until we help them find where the contacts are, whether it's in the local community or whether it's tech help. Brian Bebo and myself moderate that group, and it was Kim Kilpatrick. I don't know if she's here tonight, but Kim, when I phoned her, I said, there aren't very many people in the Sioux who use adaptive technology or have smartphones. Why can't we offer this to people all across the North? She said, sure, you can use our teleconference line. And that was before Zoom. And now we use Zoom, and we did it before lots of other people, and we get people from all across Canada. And that's what CCB is all about, is the peer support, and that's what the GTT groups are all about. And I just hope we have many, many more years of CCB and GTT groups across Canada. Thank you.
Thank you, Dorothy. I think we need to give a good round of applause for our winners. It's a little bit of a cliche amongst the vision loss community and the vision health community, but those are people that are changing what it means to be blind. Just back from a secret trip to Taiwan. Here with an update on the status of Bill 284, an act to establish a national strategy for eye care. She's a hero of the vision health community. She's the MP from Humber River, Black Creek, someone who has long demonstrated an unwavering commitment to public service and has served in various capacities at both the federal and municipal levels of government over the last 30 years. On June 14th, 2022, just a little over, well, I guess it's a little under 2 years ago, she introduced her private member's Bill 284, entitled An Act to Establish a National Strategy for Eye Care. Last October, the bill was unanimously passed in the House of Commons and is presently before the Senate. Once passed by the Senate, Bill C-284 will have a direct and positive impact on Canadians' vision health now and for generations to come. Ladies and gentlemen, my friend and vision health community's dynamo at Parliament, the Honourable Judy Sgro.
Thank you very much. Good evening, everyone. President Tackles, congratulations for 80 years. I know you told me you were 60, but the organization is 80. So I'm not quite sure how you figured that one out, but congratulations for all the work that you've done. And to the recipients, thank you, thank you, thank you. It takes leadership like what you have shown by pulling together an organization little by little with a few people here and a few people there. It creates an organization that's been here for 25 years. And you have helped countless, countless people, whether it is sitting together and crying a tear or sitting together and having a cup of tea. It's that friendship That is so important. And we say that for everybody, that we all need each other. But especially if you're vision impaired or you have some of those particular issues, we really need each other. And I think I have learned so much from all of you over this last couple of years, trying to get this bill through. Whether you know it or not, most of you are now classified as lobbyists. Because to get the bill through the House of Commons, they say it usually takes 2 or 3 years if you can get it through. Well, you know what? We got it through in under 2 years, but I didn't do that alone. I did that together with many of you who made phone calls, who wrote letters, who had meetings with members of Parliament, and got to meet a lot of people and really got all of my colleagues to understand how important it is to have a strategy. Canada doesn't have one, as you all know. Well, we are going to have one. With your help, it got through the House of Commons with a unanimous vote, which doesn't happen very often, because everybody prefers to fight with each other. But, with your help and, that massaging that we all have to do to get everybody to understand how important it is to start moving forward. As a government, we're trying to move forward on issues of accessibility, extra help for the disabled, a whole lot of things are coming together now. So we got it through the House. The next challenge was the Senate. And if any of you have dealt with the Senate, God bless them all. I'm waiting for them to pass this bill, but boy, they're challenging. I mean, you're lucky if I can talk to them, never mind, the average people talk to them. So now they have been besieged since last fall by many of you who have written letters again and lobbied them all and kept pressuring them about the bill. So Senator Revalia was invited to be here tonight, but I understood he had a couple of other events. He was going to try to get here, but he's not here yet. But I had to have a co-sponsor in the Senate, and right from the beginning, Senator Revalia was happy to do it. He maybe wished he hadn't, but he did. And he believes in the bill. He's a medical doctor, so he understands these issues even more than I do. So the update as of today was that the committee on this coming Thursday is going to refer the bill to the committee that Senator Revalia is on, and that just about everybody on that committee has openly committed to supporting the bill as soon as possible. So that Senator Plett, who is the head of the Conservative side, I had the Liberal side and I had the Independent side. I had to get the Conservative side, not that they weren't supporting the bill, but politics is politics. And I just came back from Taiwan and I said to Senator Plett, please, you get that bill in on the 21st, get it to committee or get it a commitment to committee, and I'll bring you something special from Taiwan. And I've done that. And I want to see if he does what he has to do so that we can get this passed. So hopefully it's going to get to committee later this week. We're asking the senators, as much as they want to improve the bill, to not do that. Because if they change one thing in the bill, then the bill comes back to the House of Commons and has to go through, a change or an amendment or whatever, and then gets sent back. So our lobbying job has been to just love it, but just approve it. Don't change it. And I believe that's what's going to happen, and that should happen before 10th or 12th of June. And once that's approved, it gets royal assent, and it's the law of the land. And then we're going to have a big party. I'm telling you, Michael, we're going to have a big party for that. But just on one other thing, so we know that there is movement happening. The department, Ministry of Health, ever since the bill got approved in the House of Commons, has been working on starting to develop what this strategy would look like. Who's to be consulted? And for my part, it's many of you who need to be consulted as we move forward developing this strategy. It has to have people who understand, who know the issue, that are going to be working on developing what this strategy is going to look like. But it'll make a huge difference in the life of thousands of Canadians and many of you in the room. So I'm very excited about it, and so I'm pretty sure by the middle of June, we're going to have that bill passed. And to the Council for the Blind, the CNIB, Fighting Blindness, Michael and I had almost 3 times a day conversations about who else can we talk to? So we've done it all. So it's in the hands of the Senate, and I'm very confident. So on behalf of Senator Ravalia, if any of you want to take a few minutes and make some phone calls to some more senators, leave a message if you can't get through them. Just say, I'm calling about C-284. Please get it through before the Senate rises. And I'm sure that's going to happen. So anyway, thank you all for the invitation to be here this evening. God bless all of you. Keep doing the wonderful work. You're really helping to build a fabulous country that we all love. So thank you very much. I forgot one of my partners. Aside from Michael and I talking every day, Francois, where are you? Wow, the Optometrists Association, I can tell you, without them there every day, constantly saying, what else can we do? What else can we do? And it was just an absolutely amazing organization. And Francois, thank you so much to all of you. I don't know how to thank all of you because you've all done so much. I feel like I've done such a small little thing, but it's going to become the law of the land. So Canada will have a national eye strategy, and that'll mean some real difference in people's lives. So thank you so much again.
Yes, thank you. Judy, if you got really good friends in Taiwan, what you do is you tell them to claim the people that aren't working with us as their citizens and then draft them into the armed forces and they'll have to leave the country. I have to thank Francois too. So we decided that we were going to send another letter to Senator Platt. And I think this was like the third version that was gone around. And so last year, Francois and I and some staff members and put together, and I think it was a day and a half to get 13 signatures on it from the presidents of the thing. So the 13 stakeholder groups signed it in a day and a half, and it was done. So then we decided we were going to do it about 3 weeks ago, and then a delay came up, and I'm sitting there doing the letter, and I'm looking at it, and then I picked up the phone and told Francois, and I said, I got a conference and a dinner and a whole bunch of things to do, Francois. You got to help me on this. And he reached out and he helped me, and it was fantastic that we got it done and that Francois did it. So his team put this last one together full tilt, and thank you for taking it off my hands, sir. She's the president of Vision Loss Rehab Canada. She's a good friend of, I think, the CNIB and the CCB and everybody, and she's a remarkable young lady. She's a star basketball player. I take that back. Her kids are star basketball players. Ladies and gentlemen, Jennifer Yusovic.
I'm glad he made that correction, not me. I'm too short, I have to wear heels. So great to be here tonight, and so happy to see so many faces. I feel like sometimes it's once a year we get to come together. On behalf of Vision Loss Rehabilitation Canada and really our community, congratulations to the CCB on 80 years. What an incredible achievement. And when I think about the work that CCB has done, I've been in the field for 26 years, started my career in Kitchener-Waterloo, which had a very active CCB chapter. And I remember, the peer support and, as you've evolved as an organization into technology and advocacy, one thing has always remained, and it's something that we've heard a lot about, particularly this evening, and it's the power of collaboration. When we all come together and set our sights on a mission, we can do amazing things. So I think that as I think about, the theme this morning around AI and going from, really scary AI to, building trust around AI to really embracing AI as we wrapped up with Jason's presentation. The future is really open to all kinds of opportunities for our community. And I'm so excited to be part of it. I'm so excited to be part of the collaboration with CCB. So congratulations on 80 years. And I also have the pleasure of our next speaker introducing, who I think everybody already knows the incredible work that Michael has done. But I know for our organization, and I think for many of us, Michael is this pillar of bringing people together, finding ways to come together through a shared mission, getting the right people in the right room, tapping on one another when we need to really create a Canadian strategy that really enables people. So whether we are fighting and advocating and lobbying for a national vision health strategy, or in the province of Ontario, ADP, Michael is instrumental in bringing together all of the right people. So our next presenter, or our next speaker, is my dear friend, Michael. And I said to him, is there anything you want me not to say? I feel like I have conversation with him some weeks every single day. And then, there's a few weeks, maybe not so much, but really instrumental and really passionate about the work that CCB does, and has really, brought the right people together through collaboration. So, Michael, over to you.
I don't know if anybody paid you, but it wasn't enough. I have to do something tonight I didn't really want to do. We have to talk a little bit about the Assistive Devices Program. In a letter to Patrick Descerné and signed off by the Minister of Health, Christine Elliott, dated 21 April 2022, the Vision Loss Group were told, the Ministry of Health values the contributions of the ADP Reform Working Group, and that Reform Working Group was made up of Vision Loss Rehab, CNIB, Uda Trevianis and Accessibility, Luna Bengio from, at the time, Federal Government Accessibility, Ian White, the president of the Vision Toronto Visionaries, and my big mentor in research, Dr. Keith Gordon. It was a tremendous working group, and still is, in support of Ontario's vision loss community through our development of evidence-based recommendations. And I say evidence-based is because 3 years ago, Jim Prowse came to me and said, there's some members that are having problems getting their ADP and their devices and their everything in timely manners. It's taken 8, 9, 10 months. And can you find out what the holdup is? So out of that came conversations with the government, of which we were said, well, everybody screams and yells, can you give us any evidence? So over the last 3 years, I believe we've spent somewhere north of about $60,000, and I can tell you the 2,000 hours from people that their time is priceless. And that would go for Uda Trevianis and Luna Bengio and the entire group, but none more so than Ian White. So the Ministry of Health values our contributions to the ADP Reform Working Group in supporting our vision loss community through the development of an evidence-based recommendations for assisted devices. We did a study. We had almost 500 Ontarians respond, and out of that we came up with 19 recommendations. We greatly value the efforts, and I'm quoting Patrick Discerny, Deputy Minister, we greatly value the efforts you made to garner the opinions of the 446 Ontarians and vision loss community and transform them into tangible recommendations to improve ADP. The primary goal of the ADP is to determine a set of shared goals, planned outcomes, to gain consensus on how best to address the survey's recommendations. In some ways, that's about as far as we got. ADP has a budget of around 640, I think it's 620 to $30 million. The assisted device program in Ontario, there are 446,000 Ontarians that are can apply to it, okay? We took $2.9 million out of the budget. Of that $2.9 million, there was about 4,300 people, and the big question that Keith Gordon and I had was, 446,000 people, why aren't anybody doing it? Why aren't any people applying? And what we found out was exactly where we started. Nobody wants to wait 10 months to get a computer. They would much rather go pay for it themselves. So that's about as far as we got. On in January, and again 3 weeks ago, we offered this platform right here tonight. Instead of me speaking, we offered it to the Minister of Health, and we offered it to the Premier. After 2 years of recommendations agreed to by all the parties, in August 22, we could have announced a major win here tonight. It was decided 2 years ago. A win for everyone, in particular, Ontario's vision loss community. Minister Jones, Premier Ford, it's time to step in. It's time to step up. We are being misserved, both you and the working group, misserved. There are, like I said, 446,000 Ontarians. There's another 3.1 million Ontarians that are living with eye disease that could lead to blindness. That's 10% of this province. That should be more than enough to get somebody's attention. Vision loss is life-changing, not life-threatening. Keith Gordon. Blindness does not discriminate between gender, race, nationality, political party, whether you're rich, poor, or your station in life. Created over 4 decades ago, the visual aids category, the Ontario Assisted Device Program, was principally set up to address print disabilities. They haven't changed that yet. But who's reading print anymore from the newspapers? You know, it's just not there. The mandate of ADP is to provide funding to support assisted devices appropriate for the assistive basic needs. Digital technology has transformed how we live, how we play, how we shop, and how we work. Yet, while society has transformed, our needs have evolved to embrace a digital world. The ADP has neither transformed or evolved. And as a government program designed to enable people with physical disabilities to increase their independence, it's failing through a simple lack of political will. For the ADP to realize its potential and the program to work for people, the Minister of Health must recognize that digital access is a basic need and recognize that smartphones are assisted devices. In 2018, the CNIB sent a document to the Assisted Device Program and to the Health Department, or Health Ministry, outlining the importance of smartphones to people living with vision loss. Now, a smartphone by itself doesn't help anybody in vision loss. But when you take that smartphone and add all the different apps that are available to it, right, Ian?
And invoke the accessibility tools that are built into it.
Thank you. Told you he was smart. And recognize smartphones as assistive devices. I will tell you right now, the reason the smartphones are not being made available through the ADP program is that there is an individual running the ADP program who believes that they shouldn't give smartphones to people living with vision loss for fear they will lend it to a family member or a friend. And he has not only said it once, he's not only said it twice, he has said it 3 times. Remove, reduce tax and other cost barriers for those with low incomes. Increase access to gatekeeping. Well, anyways, you get the message. So, Premier Ford, you said if you're having problems, reach out. The vision loss community, the vision health community are reaching out. You know my number. I look forward to hearing from you because your staff hasn't given us the courtesy of an answer in 5 months that was promised. Enough about the ADP. And I'm sorry to throw a sour note in it, but it might be important that this gets out, okay? Now, let's talk. Progress is possible, but it's not guaranteed. And we talked about unity and everything. So, you got it pictured up, Mohammed? This is CCB's first vision van. It was in India, and it was sponsored by the Canadian Council of the Blind, probably with the help of the CNIB. I'm pretty sure that would have been the case back then. But if you look on the door, Bear was one of our very first supporters of the vision van. Next. 1947, that's the dinner. CCB's annual dinner, general meeting dinner in 1947 took place in London, Ontario. Now, I have to talk about the last 7 or 8 years because 7 or 8 years ago, this would never have happened. In fact, 7 or 8 years ago at the dinner, it was at the Ottawa Curling Club. There was, I don't know, but I'm sure Janet McIvor will confirm, it was somewhere around 98 people. And I remember that 75 of them were curlers. We had 4 sponsors at the time. Okay? Diane Langevin from Via Rail was there. Peter Burke and Janice Preswick Davidson from AMI were there. And Peter's no longer there, but AMI is here front and center today and has his Via Rail. And then there was 2 stalwarts, our 2 major sponsors from the pharmaceutical company. And they're both here tonight. Sarah Shepard, please stand. Where is she? Don't hide. Sarah Shepard was there on behalf of Novartis, who we must really thank because they were with us for a long time. They're pretty much out of ophthalmology now, but they should not be forgotten because they were there in the lean years. And I will also tell you, and we don't tell this to too many people, that because of Sarah at Novartis, they were the people that preeminently helped launch the cost of vision loss study in Canada, which has become so consequential in being used, of which Keith Gordon was the principal investigator. And then on the other side of the room, Amy Bowes. Amy Bose was at Bear at the time. Amy, will you stand? They attended all the curling dinners, you know. They had to ask special permission to come to the big dinners tonight, but they attended the curling dinners. And so we have grown in everything, okay? Couple little anecdotal things is 7 or 8 years ago, because of Louise Gillis and Jim Prouse, I made a decision to get more involved in the CCB than just doing the magazine and the sponsorship sales. But I also felt it was necessary that we needed to expand our footprint. They allowed me to do that. And that results in what we see here today and what we saw last February and what we see last October. The number of things that we wanted to do were important, but there's things that we have to go forward with and look at. And the first thing I'll say is, Judy mentioned Bill C-284. 18 months of committee hearings are going to take place. And we have to make sure that our footprint of the entire vision health community is there. That when they talk research, it's not just medical research. We can look at the demographics and the profiles of who the patient is and who the client is and how we deal with it. That there's a national ADP program. That there's work that's done medically, and that we take care of the people. We have advances right now that are taking place in biosimilars. It was, as Keith says, as the horse is out of the barn. We've got situations regarding Bayer's 8 milligram. We have gene therapies coming in. And right now, and somebody wants to refute this, they can. In my entire time, 18 years, and coming right up to the present, at no time in the last 18 years has the vision health community and the vision loss community been better served and better ready to move forward into the future than they are right now. And you all deserve a round of applause for that. In the fall, Keith is going to speak later. The report card will be coming out. There's opportunities for people to participate as sponsors. We still need some sponsors. It would be good. We're looking to do a prevalence study in the province of Ontario. We've been talking about it for a while. It was delayed because of the of COVID and everything. But where there's 3,000 eye examinations. But the whole basis of doing it is, look, we're waiting till people are 65 to determine whether they have eye disease or to give them free eye exams. Mammograms, stress tests, colonoscopies, these are all done in the late 40s and 50s. And if we start doing eye exams and making them more accessible and readily available in people in the late 40s and 50s, then we're going to be finding eye disease earlier. And if we find eye disease earlier, we'll be dealing with moderate disease versus waiting till they're 65 or older, and even if they'll get it, and having to deal with severe outcomes. We will save the vision health community and governments across this country billions of dollars if we start doing eye exams earlier. And we already heard from the CNIB last week. They announced looking to full eye examinations for children, a program across the country, which the CCB supports, because we need to do it here in Ontario. But we can't forget our seniors. Seniors need to get eye examines, and it has to be made easier for them. So, and then there's the other thing is the belief to look at in a study that eye disease is a common denominator either across the board with the major diseases, that the one common denominator, the heart, stroke, lung, all the diabetes, all those diseases, that there's a common denominator, and it's this. So, I don't know what I missed, but we should all start looking at it. And my suggestion is that the stakeholders get together and we put a committee together to determine how we are going to approach Bill 284's committee. and that everybody in this room, the pharmaceutical companies, the stakeholders, the service organizations, everybody works together to come up with a common push to what we want. If not, other sources are going to try to get involved, people that you don't want making the decisions for us. So we need to do that. So I throw this out on the table as something we can talk about over the next while, but I look forward to additionally having an opportunity to talk to anybody individually about it, and I thank you for your time. Canon heard, just in time. Do you want to?
I'll speak from the diaphragm. Just want to offer my congratulations to you before I say the holy stuff. For your work, as I look at this community, what I see is compassion embodied in the lives of all the people sitting around the table. You may not feel like this, but you indeed are a blessing to all individuals who are isolated. You bring them a sense of hope, you give them a sense of purpose, and you tell them that they are valued. So I thank God for that. I must admit it's the first time I've ever heard a member of Parliament wish a blessing on another house, by the way.
Diaphragm's not working? Okay. I would just ask you to bow your heads. For food in a world where many are hungry, for faith and commitment in a world where many walk in fear, for fellowship in a world where many walk alone, we give you thanks, Creator God. Amen.
Thank you, Canon. He's a senior research officer at the Canadian Council of the Blind. He's a past vice president of research at the CNIB and past research director of Blind and Low Vision New Zealand. Dr. Gordon is also an adjunct professor at the Department of Ophthalmology and Vision Sciences at the University of Toronto. And he was a principal investigator of the CCB study, a report card on the vision health in Canada in 2021. Ladies and gentlemen, please welcome Dr. Keith Gordon.
Okay, thank you very much, Michael. Sorry to hold you up from having dinner. I hope you're not too hungry. In October 2022, the Canadian Council of the Blind, in partnership with Fighting Blindness Canada, and I won't forget to have a shout out to Larissa Moniz, who was instrumental in partnering in this study. We published a report card on vision health in Canada in 2021. The objectives of this report card were threefold. The first one was to assess the impact that the COVID-19 epidemic had had on the state of vision health in Canada and the extent to which vision health had rebounded from the detrimental effect of the pandemic. The second objective was to assess how people living with vision loss were dealing with the latter stages of the pandemic and whether there were any major issues where assistance or advocacy was needed. And the third objective was to measure the funding of vision research in Canada in 2021 and compare that to the funding that was available in 2019. The report card we published in 2022 found that Canadian vision health overall had improved in comparison with that found in 2020, but that significant backlogs in surgical, clinical, and optometric services still existed. People living with vision loss were found to be less stressed than they were in 2020, but the impact of the pandemic was still being felt in the vision loss community. 2 years have now passed since the last report card, and we felt that it was essential that we ascertain whether there's been any improvement in the state of vision health and the condition of people living with vision loss. Are we back to pre-pandemic levels? Are we better than pre-pandemic levels? We don't know. So we felt it was essential to go and evaluate these issues again and see how we compare. This year's report card, which we are currently working on, will be evaluating most of the metrics that we looked at in the last report card, as well as some new ones. And I'm going to run through them. Sorry to keep you from dinner, but I think it's worthwhile telling you what we're going to do. We'll be comparing the number of eye surgeries, the usage of ophthalmic pharmaceuticals, and the wait times for ophthalmic surgery in order to assess the extent to which the COVID-created backlog has been overcome. We will look at the number of optometrist visits and assess how many people have had a complete eye examination in the past year. And you've heard Judy and Michael talk about the importance of eye examinations. We need to know whether people are actually getting them. By conducting a series of personal interviews, we'll be assessing issues, and before I do that, I should have a shout out to Chad Andrews, who's going to assist us with conducting the personal interviews. I don't want to omit somebody else, so thank you, Chad. By conducting a series of personal interviews, we'll be assessing issues that are affecting the practice of ophthalmology and optometry, and whether there were any lasting effects created by the pandemic. We'll be assessing the total funding of vision-related research in Canada to see if there has been any change from 2 years ago. We'll be looking at the number of ophthalmic drug approvals by Health Canada in 2023 and the status of reimbursement by province of all medications previously approved by Health Canada. We want to make sure that ophthalmic drugs are being approved at the same level and the same frequency as all other medications, and that we're not being put at the bottom of the pile. And we'll be giving an overview of emerging issues in vision health, the three main issues being, firstly, the emerging gene therapies for eye diseases. There is now an available gene therapy for eye disease. It treats very few patients. It is very expensive, and these are issues that are going to have to be dealt with in the future. The second issue that we're going to be addressing in the report card is the huge increase in myopia levels in Canada, particularly in young children. I don't know if you're aware of it, but myopia, short-sightedness, is at pandemic levels throughout the world. The World Health Organization is projecting that 50% of the world will be myopic by 2050, and that's true in Canada as well. There's been research done in Canada that shows that, particularly during COVID, that children, the level of myopia amongst children grew, whether it's because they spend their time looking at screens up close. There is evidence that shows that if you go outside, spend more time outdoors, there is less myopia. So these are issues that we want to report on and hopefully have addressed. And finally, you won't believe it, but the third issue we're going to put in the report card is artificial intelligence. so that's part of the reason for today's conference, and we will be addressing some of the issues associated with AI that you heard this morning. And finally, we'll be reporting on any government activity, either provincially or federally, that affects vision health. Most notably, the progression of Bill C-284, which you've all just heard about from the Honourable Judy Scrow. All of our findings will be reported at the next CCB conference, which will be held here in, I don't know if it's here, but anyway, it'll be held in October. And we hope to see you all again there. Thank you.
Thanks, Keith. We're going to start our starter service right now, but before we start, as we start the starter service, and for the salad level of this, I'm going to bring the host of Kelly and Rama show, Kelly McDonald, to the fore. Kelly is the AMI TV's morning host with his partner.
I learn a lot at AMI, by the way. Why would you ever want AMI guests speaking at your talk? Come on. Oh yeah, I'm Kelly McDonald from Kelly and Ramya at AMI. And thank you, Mike, for the introduction. You can catch us. If by the chance, while you're eating your salad, if I say anything in this very serious upcoming conversation that makes you laugh, it's not my fault if you choke. I'll try not to choke up here talking to you. It's interesting, too, because my CCB chapter said to me, "What the heck are you doing going there to Ottawa?" I said, "I don't know." Mike said, come to Ottawa. I was at the CCB event celebrating their history, their anniversary in March. Ian White and the gang invited me up to MC, and Mike come to me over and said, "Hey, give me a call later on this week. Want to know if you might be interested in some other things." And all of you know, when Mike says, "Give me a call," you call. You just go, "Yes, sir. What can I do?" Very honored and pleased to be asked to be here today. Now, my first involvement with CCB, I had not heard of CCB. When I moved to London from Montreal, hung out in that Tweedsmuir Hall, so really wonderful to know 1947 they were doing CCB dinners and stuff in there already. Like really, really wild stuff. But I remember I was in downtown London. I was doing a radio show at Radio Western. And I've been involved with CCB, I think, close to years. It was early in the 90s that I started. Let me put it to you that way. So what's that, 30 years? So, and I remember standing at a corner, waiting for a bus. I was leaning against a wall, holding it up, and a lady walked back and forth in front of me. Back and forth. And she turned to me and faced me and said, "Why are you not a member of the CCB?" Well, I thought it was a street gang, right? And I know nothing about gang colors. I'm colorblind, so I put my hands up and said, I don't know. You tell me. And she went away. So, I don't know, maybe it was a month or two later. Back and forth in front of me. I could see that person again. I think that's the same. "Why are you not a member of the CCB?" Well, I don't know. What's a CCB? So, not long after, I joined the London chapter, which at the time in the early 90s, we had about, I recall once I became part of the board, I think we counted up as high as 106 or 7 members. It was phenomenal. But, of course, that's what happens when you invite everybody out once a month to eat food. None of us here can relate to that. It was tremendous. So one of the goals, of course, that CCB had at that time was let's try to get some younger people involved. And I was a younger people at that time. I wear the hat so I can still fool people, but apparently the eyebrows as they're kind of salt and pepper betray me. So I got involved and got a few other people involved. Now, one of the things we learned, because our thought was the variety of things we need to have. Let's have some outings that took us out of the CNIB auditorium. And CNIB had just moved into its new space in London at that time on Baseline Road East. Wonderful. So we used to get confused if it was an auditorium or a gym because of the way it was designed, right? So our viewpoint, let's get different things going on. Let's try different. Some people, no, I don't want to be going out to do that. I don't want to. So we'd suggest different ideas. But one of the things that dawned on me was, let's have ideas that make people who want to participate in this particular thing maybe go to the park, listen to the jazz music on a weekend where there might be some stuff going on, music in the park. But others who may say, no, I'm fine with my monthly meeting. Not take that from anyone. And I was empowered by our fearless president at the time, the late Bill McLaren. And Billy was a great old soul. He'd, "Come on, Kelly, let's go." And we'd have so much fun trying to plan out things to do with our board. Now, the lady who was harassing, trying to get me to join on the street, she was the treasurer at the time. She was a sighted person who felt the value of CCB. And at that time, CCB, 50 years old. So I started to realize how important it was to be a part of a chapter that kind of saw vision to get everybody involved, but serving so many different people. At that point, not long after, CNIB gave up White Cane Week. At that time, CNIB basically oversaw White Cane Week, and CCB grabbed up the ball and started to run with it. And I had started to volunteer with CNIB doing it as an amateur radio operator, and we would go there, set up an antenna, and broadcast from there, and it was just a great old time during White Cane Week. A lot of fun. So when CCB took it on, we started to try to do things that meant let's invite everybody in. And of course we know that that's really to get the PR out there for what the heck CCB is. So for me, it became a lot of different things, and it empowered me, especially when I started to work at AMI, and my manager would say to me, Kelly, I'd like you to take on this project. Oh, you have about 2 weeks to get this done. Could you do this? Oh, yes or no? Oh, yes, I guess. What's the problem? Well, at that point, I'd been a part of a board, but I wasn't really that comfortable with the commitment. I didn't want to say, okay, I can do that in 2 weeks, no problem, because I really didn't know or believe in myself at that point. I had more from being empowered, from being on the CCB board in me than I used to think, but I still, and I'd get that, say yes, you can do it, right? Yeah, sure, but what? What if I can't do it in the 2 weeks you want me to do it? Well, then I learned what everybody else says. Well, then just simply say you can't and ask for an extension. Really? That's all you got to do. It's not a trick. Really? Well, I'll commit to everything. All right. So that really helped me get a lot of encouragement, as well as realizing where I got that started. Not long after, I got on the board of the Glenville Players Theatre Troupe. And this is how I kind of got to know Jim Prowse a lot more. I would call and ask Jim all sorts of questions, because one of the things we started thinking about was, did we want to be a CCB chapter? We wanted the support of the insurance because of the places we'd rehearse at in Toronto, and the not-for-profit number came pretty handy too at times when renting theater space. I remember a time once we became a chapter, we were putting on a fringe program at the London Fringe Festival, as a matter of fact. But we ran it before that at a small theater space that we could afford in Toronto in the West End. And this was just what they call a black box. Walls all painted black, dirty floor and everything like that. We set chairs in there, we did our show, could hold about 50 people. You're running back and forth behind the curtain to do your things. Well, we had a scene where I had to change from being in dress clothes into jeans, a shirt, cowboy boots, and a leather jacket. And I had to do it between scene 1 and 2. So while the guys start scene 2, I was actually off stage hurrying to do this between the scene. I got on, I changed, I got my pants on, I pulled them on, I got the shirt on, tossed a leather jacket on, tried to put the boots on, lost my balance and fell through the wall. I mean, I dented that poor wall. Later on, we had to explain that, and I had to pay for that. But, got out there on time. But if we weren't part of CCB, and no, CCB didn't pay for it, I did. It was really what made me realize at that time, we're doing theater here. CCB's helping us be able to do that. We all know, as we've heard today, about the curlers. My memberships at times, I played with the curlers in London. When I had an opportunity to curl, and of course with the chapter, and of course with Glenville when I was back in Toronto. So I've certainly paid my dues and certainly have found the value, because what that's led me to as a member is understanding CCB can be many things to each one of us. Whether you want to do advocacy, tonight we've heard a lot of advocacy and all the smart things that have been said today overall. Well, that's why they cut 5 minutes off my time, because half of those things I was going to say. But you know, who's counting? These guys, everybody here's so smart about things, and it's really been wonderful to learn that. But what I learned with CCB is how CCB is a variety of things, whether you're into advocacy, whether you want to curl, whether you have an idea for something different to try, lawn bowling, whatever it might be, whether you just want to sit with a chapter, hang out and get out, especially important to those new to blindness. I've learned how much those of us who have been blind all our life, I almost want to say we take certain things for granted. We're used to certain things, but still nice to have outings, still nice to be involved, still nice, and especially if people want you to kind of mentor. Help me out, give me some advice, especially the people who are newer to blindness. Not everybody wants to be an advocate. Some just want to watch TV at home. Some just want to have someone to go for walks with and do different things. And sometimes we just, oh yeah, well. But if we've been blind all our life, maybe we have that, be a family. Maybe we have friends that will do that kind of thing. Or we just know our area enough and we're comfortable to do it. But I've learned doing the theater troupes that I've done, my out-of-sight theater productions in London and working with Glenville, that alone, I've learned how important it is to do something that you never thought you could do. When you've lost your vision, what am I gonna do with myself? What is there to do? Is life over, as we talked about, Keith said a while ago, quoting? You know, the reality is, or excuse me, I guess Mike said it, quoting Keith, that you know, blindness is not a death sentence, basically. It's an physical inconvenience, a damn nuisance at times, but doesn't mean life's over. And sometimes, as we all know, it's hard to disseminate that to other people. And then for them to believe it. So you gotta show it. And for 80 years, CCB has been able to do that. And been so many things for different people, whether you just need to know about technology because you've been blind all your life, you're a senior having to learn it due to the damn pandemic, whatever it might be, you have an opportunity because this CCB thing exists. This thing that when I was a young man and somebody said, why are you not a member? Yeah, why? Yeah, sure. All right, yeah. Oh. And I got to learn and meet a lot of people. And for me, mostly, be inspired to say yes, to not be afraid of being on a board, to also not being afraid to say, no, that's not for me, that's okay. And to say, okay, maybe you're not so interested in advocacy. Hey, I am. And realize that one chapter can do different things, be different things to each person. And I found that the most valuable thing about CCB, and I feel most people overlook it. But to know, you got to learn a lot about the different chapters around. You got to hear things. And maybe I'm in a privileged position with work, so I get to learn about the different chapters around. Oh, that chapter does a little of that. Oh, that chapter over there in that town does more of that. Hey, who's getting that signed for all of us? Who's representing the blind and low vision community? Oh, those guys over there in Sedville. And that is so important because it has to be the way. We all need somebody to tell us, hey, we should support this, we should be a part. Yeah, I will, okay, thank you. Yeah, I think so. Or no, I don't even know. Not even important to me. And I have learned how valuable that is to thank those who are willing, who do live for that. And some people, especially when CCB, CNIB, any of our organizations we mentioned tonight, help any of us out and make a difference. And I think that's the worst thing being blind all my life. I've taken things sometimes for granted. And when someone's so proud of the White Cane Week CCB does, and you ask them why? 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 Because when I went blind, that week was there. I got to go back and talk and say, this is what helped me when I went blind. This is what I was able to do when I went blind. I was terrified, and somebody listened. Somebody at CCB, I was able to go out to a CCB event, stand at a mall, and somebody else come up to me and say, my son has been diagnosed with an eye condition. I really don't know what to do. Oh, come on over here. Let's talk. Do you have time? And that feeling, that mentorship, it's a special power we have. You know, there's enough in life to get you frustrated. I can't drive. Jeez. It'd be easier, especially with it pouring rain out there. Oh, I have this problem. I have to go get that. I wish I could drive so I could load up a truck with this. Whatever it might be that you need that support and help, and sometimes those inconveniences are there. Some of us are real creative, so for some of us, it doesn't matter. They'll throw a TV like the one I just went behind on my back and cart it, and the last time I had to do that, we were running from the police. But it's so, to me, the most amazing thing that flies under the radar. And I think it's because we've got so many other things we're trying to do, trying to accomplish, mostly just getting people out. Just getting us out to socialize, just getting us out to get exercise, all those real important things. But some of those things just we don't notice because you mentor by action. You don't have to preach at anybody. You don't have to, lecture somebody. Well, you should be doing this. It's a matter of, hey, man, we're all going out to do this. We're going to go to Open Doors this weekend as a trip for CCB. What's an Open Doors? Well, let's go and rent the bus and find out. And for me, that is our superpower position. Our power that we just take for granted because we just do. These folks here up here today talking, telling us so many different things that they're able to share with us, they do it because they just do. It's important to them. They have the knowledge, the skill. They're there to share it with you, whether you want to listen to it, whether you want to be a part of, sign up to do, or just love that we can take advantage of CCB and enjoy what it offers. So for me, being a member, that is what I've learned over the 30 years of being a part of CCB that is real special. That is what I think for me being able to get up here and do this and speak from the heart, because otherwise those CCB Londoners are saying, why are they having you talk? What are you going to say? I don't know. You talk 2 hours a day. Isn't that enough? But it makes me feel good to be able to say, yeah, man, Mike, actually, you know what? I do have something I'd like to share. Some things I've noticed about CCB and the special power being a member gives. So congratulations for 80 years, 80 very special years, and mostly to people like Dorothy who can get up here and talk about her chapter, things that have gone on. People need that on that basic level of, this is the chapter I belong to. They may not have a clue we're all meeting here tonight. Maybe they're watching on Zoom or YouTube. That's wonderful. Thank you, guys. But it's the reality of, what the heck can I get done? What can I do? What is this group for me? And it's a special permission to make sure you take advantage and enjoy CCB for what you can do for you. And the fun you can have, the enjoyment, mostly wrapped around in a group 80 years old to support you that doesn't even look a day over 10. Thank you very much.
Thank you, Kelly. That was great.
I am Deborah Gold, I used to be executive director. I'm now CEO of Balance for Blind Adults, and with me are my two friends, Angela Bonafanti and Jennifer Urosvich from CNIB and Vision Loss Rehab. And we thought, since an 80-year cake was cut, that we should lead the room in Happy Birthday for CCB.
No, we thought Deborah should lead the room in a song.
We're the backup singers.
You better sing with me.
We will.
Okay.
All right.
Ready? 1, 2, 3. Happy birthday to you. Happy birthday to you. Happy birthday, dear CCB. Happy birthday to you.
Good evening, everyone. Are you able to see me, or do I need a stepping stool? All good? So my name is Catherine Langlois. I'm Senior Advisor in Universal Accessibility at Via Rail. Honored to be with you tonight. Via Rail is proud to be part of this amazing community. And tonight I was supposed to talk about a train schedule, something along those lines. But you know what? I changed my mind. I have something way more exciting than a train schedule to talk to you about. Let's talk about autonomous wayfinding at Ottawa Station. And before diving into that, I would like to thank Michael for having mentioned previously that cell phones are essentials for people with vision loss, because we are piloting a new project, an autonomous wayfinding project at Ottawa Station. And the tool that we're gonna implement is an app for a smartphone. And it's gonna be free, but you need a smartphone to use that. So we are piloting that beginning in July. It's gonna be for 6 months. And of course, you are all gonna be able to test it. We are working in collaboration with our partners in many advocacy groups all over Canada, but mainly in the Ottawa region. We have lots of partners helping us through that project, but I don't want to say too much tonight. Stay tuned, more to come, and when time arrives, please come and test that new amazing tool that is gonna allow people to navigate autonomously in the station without having to ask for help or any kind of indication. And if that goes well, we're gonna be able to implement that tool in our other station by phase. So we're striving to have all of our stations fully accessible, and this tool is part of the plan. So we'll let you know about this in the coming weeks, but Via Rail is really committed to have autonomous wayfinding in all its network. Thank you.
Thanks, Catherine. And since she doesn't want to talk about it, I do. For those early birds that are in a hotel in either Toronto or Ottawa, and it's 4 o'clock and you gotta wait for 5:30 or 6:30 for a train, Via Rail's got a new schedule coming, and that schedule leaves here about, I don't know, what time is it, about 10 after 4 in the morning? 10 after 4 in the morning, but it gets into Toronto at 9 o'clock. And there's a train that leaves Toronto that gets into Ottawa at 9 o'clock. So people can travel, and and if you're going business class or whatever it is, you get to sit there and sleep or work your desk, and who knows, they'll give you a sausage and egg breakfast. So anyways, thank you, Catherine. Ladies and gentlemen, one of CCB's very best friends, one of the persons that worked very hard on the Vision Loss Committee with the province of Ontario, but one of the world's most renowned individuals on accessibility and assisted devices. I'd like to introduce Uta Trevianis. Uta.
Thank you, and I feel a little like I've been hogging this podium today. How many of you have enjoyed today's event? Can we give a hand to Michael? I want you to find the White Cane magazine and open it up to page 47. You each have one, so remember to take it home as well. And given that you enjoyed today's event, I want to invite you to another event, to participate with us in an experiment. And this particular event is a call to action. And we've asked the international disability community, what are those intractable challenges that we have to have progress on, that we've been talking about and talking about and talking about, and now we need to do something about them. And we've invited presentations, which are all available online. And what we've done is we've used what we call in the university a flipped classroom. Does anybody have kids at school who uses the flipped? Yes, a few hands went up. And so what we're doing is those presentations anyone can view at any time and at their own time, before, during, or after the event. And when we get together for 2 days in Montreal on the 27th and 28th, we've organized 20 workshops to look at huge challenges that require everyone's input. So you won't be passively sitting listening. You'll be listening to your colleagues and you'll be contributing, because we need your insights, your collaboration, your experiences. And amongst the challenges include: what is the impact of climate change on people with disabilities and how do we prepare? What are better housing alternatives when aging with disability? How do we create a reliable assistive technology ecosystem? And Ian here, Ian White, is going to be a facilitator and provocateur for that one. For each of the challenges, we have a facilitator and a provocateur organized. We have workbooks where we will capture the plan and the proposal. And after the 2-day event, we will continue working on it. So please come and help us address these things. We're also going to celebrate our accomplishments so far. So if you've liked the company here, come to Montreal on Monday and Tuesday. We still have some openings for registration. And thank you very much for all of your support and all of the words of encouragement that we've heard today with respect to the ADP challenge, the AI challenges that we have. And I think somebody here said it earlier, that collaboration is the best way to move forward on many of these things. So thank you.
We mentioned this morning, but we want to mention it again this evening. Been informed that Michael Hayes passed away peacefully on Monday, May 6th, at the age of 76. Michael was best known in his contribution with the Lions Club organization, and the Lions Clubs are here at the back here. But as far as the council goes, he's best remembered as a great blind curler who was one of the founding organizers of CCB's annual Blind Curling Championships, which will be returning next year. The family will receive condolences Friday, and his funeral mass will be on the 31st of May of this year. So our deepest condolences to Michael Hayes' family, and God bless him. As we close the evening, I have to thank the presenting sponsors who allows this to happen, because we couldn't do it without them. It's not just the dinner, it's the conferences, it's the publication of White Cane magazine, and truly, it's an advocacy that you ask them to support, okay? And they're willing to do that. And so it's important that we thank Abby V, AMI, Apellis, Astellas, Bausch+Lomb, Bayer, Biogen, Johnson&Johnson, McNamara, Roche, Specsavers, and Via Rail. We couldn't do it without it, and we wouldn't be here without them. So I would like really, and every one of them is represented here in this room tonight, but I would really like to give a big round of applause to our sponsors and to engage the dinner sponsor.